Hello everyone, I will be presenting on my capstone project with a focus in sports nutrition within the exercise science master's program. I decided to develop a project plan to study for and feel confident to sit for the American College of Sports Medicine Certified Personal Trainer exam. This certification outlined initial consultation and consultation aspects, exercise programming and implementation knowledge, exercise leadership and client education, as well as the legal and professional responsibilities. So to study and comprehend information, I read 2 of the American College of Sports Medicine textbooks. So there was the Resources for the Personal Trainer textbook, as well as the Exercise Prescription Guidelines, which I have included at the end of this presentation. So content-based learning outcomes. The American College of Sports Medicine Certified Personal Trainer exam outlines a knowledge and understanding in both patient assessment as well as including potential risks and health screening. So the ACSM specific risk stratification, so absolute and relative contraindications to exercise, when a client should not exercise, and when you as a professional need to refer out to get client cleared medically by their physician, or maybe refer them out to a different professional to better help them. This is done via a physical activity readiness questionnaire, so you will have the patient take this PAR-Q plus, and this will be a component of the initial consultation. Understanding the different stages of change with SMART goals developed, so this is something that you do with your client, and developing a client base and retention. So retention is identified as more important because you can have your clients talk to their friends, talk to their family, and develop that trust, which builds clientele, versus focusing so much on having new clients come your way. The ACSM does mention a lot of specific populations, so pregnancy, those with hypertension, diabetes, older populations, even youth. And then it does go into a lot of the legal issues and responsibilities as a professional. So I did learn quite a few life lessons. One thing that I wish I had done was understood a little bit more, maybe looked into specifically what each section had included and how long these chapters were. Then I feel like I could have better learned time management in setting up my weeks. But I did develop a very great respect and appreciation for the personal training world and all that they do to make themselves successful, as well as better time management overall, better future planning and preparation, and developing what works best for me, realizing that slow and steady definitely does win the race. And what I mean by that is comprehension over completion, and understanding overall that there's tons of different certifications out there, even just specifically with the certified personal trainer, but that the ACSM was the best choice for me. So clinical implications for this exam definitely will expand my professional scope of practice, and anyone that's working within the nutrition world knows that nutrition and exercise science go hand in hand and vice versa. So with athletes that I work with in particular, understanding how to best prescribe nutritional recommendations with their specific exercise program at hand, and understanding that how exercise can be utilized to reduce risk of cardiovascular disease and many other health concerns, along with a balanced diet. So because I have that knowledge on specific populations, it's going to be very helpful with all sorts of clients that I come across, and overall expanding my horizon and opportunities. So there was definitely quite a few challenges, especially time management within such a short window. And within the coursework, the longer chapters definitely was a challenge. Those would kind of come as a surprise when I wish I had looked at those specifically before planning out my coursework. The reading and having time to study was definitely a challenge as well. Overcoming a little bit of testing anxiety, but getting used to the format and getting to take a look at what that would look like definitely did help prepare me. And overall understanding application versus memory. So not just focusing on memorizing, but clinically applying that knowledge that I've acquired. And here are my resources. So there are those 2 textbooks that I utilized. And I want to thank everyone for your support along the way, and best of luck to all future endeavors.